I'm, as Anna said, my name's Hillarie Hagen, and let's see here, let's see if I can get my slide to go. Just since we don't have my web camera up, this is me. I work at Idaho Voices for Children, where we champion policies in Idaho that help kids and families thrive. I've been working here about 3 years, mainly engaging with impacted individuals on healthcare policy issues and helping coordinate Close the Gap Idaho, which has been leading the Medicaid expansion effort that I'm here to talk to you about today. I know Anna kind of introduced me a little bit, but a little bit more about me. I was born and raised here in Idaho, spent a good chunk of my life up in a very rural part of Idaho. I absolutely just love living here. I love the outdoors. I have 2 boys and a rescue dog named Rudy.
So I think we're going to be able to,
Anna? Sorry, it looked like we got some feedback coming back there. Just a little background. I got really interested in healthcare policy many years ago. Ultimately, my passion has been around access to care for Idahoans, largely because of my own personal experience. I lost my own father due to untreated mental illness, and then I also spent many years as a struggling single parent going to school and falling in the health coverage gap, going without health coverage. And so healthcare access is really important to me, and I'm just very privileged and grateful to be able to do the work that I do. And I am definitely just very excited to be here today to talk to you about Medicaid expansion. So a little bit about what we're going to go over today. We're going to talk a little bit about Medicaid expansion, the history of it, kind of how we got to where we are today, a little bit about the legislation that was passed last session around Medicaid waivers, just what Medicaid expansion looks like currently here in 2020 in February. I'll talk a little bit about how you can enroll in some services that Medicaid covers, and then just other opportunities. So as I kind of mentioned earlier, I have been working to help coordinate Close the Gap Idaho over the past several years. So a little bit about Close the Gap Idaho. It is the effort that has been leading for a legislative solution to close the health coverage gap here in Idaho for Medicaid expansion. It is a network of about 5,000 organizations and individuals statewide. And it basically consists of individuals across the state who are a part of our broader network, as well as being organized by a steering committee of representatives from organizations listed here. So let's talk a little bit about Idaho's health coverage gap, history about how it came about. So in 2014, as a result of the Affordable Care Act, thousands of uninsured Idahoans actually became eligible for a tax credit to help them purchase health coverage through Idaho State Health Insurance Exchange. However, about 62,000 Idahoans didn't qualify for the tax credit, and that's because their income was too high. And it was also simultaneously their income was too low, and simultaneously their income was too high to qualify for regular Medicaid. So that may sound a little confusing, and it kind of is. It's like, how can you have your income too high and too low at the same time to get help with accessing health coverage? So just kind of some context, for a family of 4, working parents were not eligible to receive Medicaid if they made over around $6,000 annually, and they couldn't get a tax credit through the exchange to help purchase health insurance if they made over about $25,000 annually. And kind of why this happened, why this health coverage gap was created, is because when the Affordable Care Act was originally passed, it was meant to expand Medicaid all across the country in every state. But the Supreme Court ultimately came back when it was challenged and said that the Affordable Care Act in itself was constitutional, but it could not mandate every state expand Medicaid. Each state had to choose to opt into Medicaid expansion programs. Idaho was one of those states that chose not to expand Medicaid. So here for about the last 5 years, Idahoans in the coverage gap went without access to affordable options for health coverage. And so many Idahoans were working hourly jobs such as childcare, agriculture, basically where they're not in control of their hours and wages would fluctuate and their employers didn't offer health coverage. So about 62,000 people fell into this health coverage gap. So since 2014, Close the Gap Idaho has been working to lead the effort to close that health coverage gap and have a legislative solution to the health coverage gap here in Idaho. So we coordinated with individuals and healthcare stakeholders and organizations statewide. We educated the public and lawmakers about the coverage gap and the need for a solution by just providing data and research and ultimately sharing stories of impacted Idahoans. And so over many legislative sessions, we worked really hard to raise awareness and to help them understand how important this was and to have a legislative solution. And we came very close numerous times. And finally, in 2018, after another legislative session where no action was taken on the health coverage gap, ultimately what that led to is signatures started to be gathered to put Medicaid expansion to the voters. So there was an incredible public support for closing the health coverage gap. I mean, this is an effort that has been led by Close the Gap Idaho for years to really try to shore up the public support and knowledge about the need for closing the coverage gap. So because of the legislative inaction and because of that public support, when signatures started being gathered all across the state, and ultimately, it was officially qualified for the ballot. Signature gatherers were able to go around and get enough signatures to be able to do that and put it to the voters. So the statewide campaign was called Idahoans for Healthcare. And basically what the whole Idahoans for Healthcare campaign was, it was formed to educate voters on the importance of voting to close the health coverage gap by voting yes on Proposition 2 Medicaid expansion. So this campaign consisted of Close the Gap Idaho members, legislators, and volunteers that helped collect signatures. And kind of my role in all of this is I worked mainly throughout the whole campaign collecting stories of people who were in the coverage gap and really help make them the face of the campaign. These lovely people you see here and these beautiful families were pivotal in sharing their stories throughout the campaign. You may even recognize some of them. We have Nicole and her family, Jessica and her family, and then Josh and his wife, Pam, he was a veteran who had coverage through the VA and his wife fell in the coverage gap. And so we were able to really lift up their stories and share across the state why this was so important in Idaho. And when voters went to the polls, they had healthcare on their mind. They knew that this was an issue that needed to be taken care of. And so ultimately it passed with 61% voting in favor of Medicaid expansion. It had very strong bipartisan support across the state. And ultimately, by voting in favor of Medicaid expansion on the ballot, it made it a part of Idaho law. And it's kind of a cool thing to know. It passed with higher support levels than any other state in history for a Medicaid expansion ballot initiative. So at the time when we were voting on our ballot for Medicaid expansion, 2 other states also had it on their ballots, and they were closer to the 50% mark. And then just also kind of give you some more context, about 80% of Idaho counties voted in favor of Medicaid expansion. So about 35 of 44 of Idaho's counties voted 50% or higher to have Medicaid expansion in Idaho. So basically, after Medicaid expansion passed in November of 2018, Close the Gap Idaho knew that we immediately had to get to work because what needed to happen to ensure it was implemented in Idaho, it still needed to be funded. the first 6 months or year would need to have an appropriation from the legislature to be able to fund the state's share, which after, with how much broad public support there was, it ultimately took all the grassroots coming together, people coming together, and really showing Idaho legislators that this was important to Idaho. And so they were able to pass the first 6 months of funding for Medicaid expansion. Because of when it was set to be implemented, only the first 6 months had to be appropriated in 2019 legislative session after it was passed. So a little bit about the funding of Medicaid expansion. The federal government actually covers 90% of the cost, and the state only has to cover 10% of the cost. So for the first full year of implementation of Medicaid expansion, it would cost the state $44.6 million. But the good news is there is a lot of state offsets and savings from other programs that state dollars were going to be able, that we would be able to see savings from, because they would now be able to be covered under Medicaid expansion. So there's around $31 million in corrections, behavioral health services, hospitalizations, catastrophic and indigent care programs that we were going to be able to see savings because they would now be able to take those funds that the state was putting into those programs and instead have it go to Medicaid expansion because it would be covered under Medicaid expansion. And then also too, just there's a lot of economic benefits that the state is going to see. When you have about 62,000 people starting to access health coverage that didn't have it before, they're going to the doctor regularly, they're getting their medications, they're able to go to see a counselor, they're able to get their surgeries and health conditions taken care of, you're going to start seeing an increased need for healthcare providers. So in the first year, we see about 5,600 new jobs being created with on average around $50,000 annual salary. That's just an average. And then because we're going to start seeing all those new jobs being created, we're seeing about $400 million from the federal government coming into the state of new dollars going into our economy, seeing healthcare providers go out and get their hair cut, getting gas in their communities. All of this economic activity generates new state dollars and revenue that is going to go to the state. And so about $16.9 million in new revenue just from the economic growth. And then ultimately, when you add all that in, all the state savings, all the additional revenue, Idaho actually comes out ahead, even after that first initial investment of $44.6 million. We'll end up, after the first full year of implementation, so by 2022, we actually see a net savings to the state in about $3.5 million. So I'm going to pause there before we go into the next section and see if anybody has any questions that have come through the chat. Anna?
Yeah, Hillarie, so if anyone has any questions, just feel free to type them into the chat box and I'll read them off to Hillarie. And I'm sure we'll have another question session later on as well.
Yeah, and I'll give you just a couple of seconds to add that in, and I'm happy to answer any of those. And then as well, anytime throughout the presentation, feel free to add questions in, and I'll get to those. So I'm going to go ahead and move forward and talk a little bit about the Medicaid waivers. And that's probably a really confusing term to a lot of people, and that's totally fine. So last legislative session, basically what happened, in addition to Medicaid expansion being funded, the legislature also passed a bill that mandated the state to apply to the federal government to make changes to Medicaid expansion. So because Medicaid expansion was passed via ballot initiative, it was codified in Idaho law. So Medicaid expansion is a part of Idaho law that is in statute according to the federal statute. Basically, if the legislature wants to make any changes to it, they have to ask the federal government to do so. And that process is called through a waiver process. So basically, it's whenever the state wants to deviate from standard Medicaid law, they have to do so by applying for a waiver, which means they're asking the federal government to waive those current standards. So there were 5 waivers that the legislature mandated the state apply for. And the first one is called, which many of you may have heard of, is called the Imd Waiver. And it's basically the Imd Waiver stands for Institutions of Mental Disease. And the Institutions for Mental Disease Exclusions has been around since Medicaid's enactment in 1965, which basically has prohibits the use of using federal Medicaid dollars for providing Medicaid dollars for inpatient care in facilities that have more than 16 beds available. So many institutions and facilities and nursing facilities here in Idaho that have more than 16 beds, they couldn't use Medicaid dollars to cover inpatient care. So the Imd waiver basically asks the federal government to allow us to use Medicaid dollars to cover facilities that have more than 16 beds. This really actually has broad support. It's going to be really good for the state to be able to have greater access to care for people. It's going to provide a better reimbursement for mental health treatment and also increase access in rural areas of the state. This is something that has been approved in numerous other states, and so we expect it to go through, and we should be seeing the approval from the federal government on that waiver pretty much any time in the next few months. So that's really positive. Then the next waiver that was required of the state to apply for was kind of, it's a healthcare exchange waiver, which basically asks it's a 1332 waiver that asks the Affordable Care Act to waive certain requirements of the Affordable Care Act, basically for the healthcare exchange where you can have a tax credit to purchase health insurance. And it wanted to give, this waiver basically would give people the option between 100 and 138% of the federal poverty line to choose Medicaid as their coverage or to have a tax credit to get an exchange health insurance plan. Now, this has been submitted to the federal government. The federal government came back and actually rejected this waiver simply because one of the rules of waivers is they cannot cost the federal government any more money than current law. And under current law, the federal government actually would spend more money covering people on the exchange than Medicaid. Then the next one is actually the work reporting requirement. And this one has been really largely in the news a lot, so you may have heard about this. Basically what the work reporting requirement waiver would do is it would change the eligibility rules for Medicaid expansion. And basically what it is it would require, if approved by the federal government, individuals would have to volunteer, be in school, or work 20 hours a week to qualify for Medicaid. There are a very long list of exemptions that people are allowed to apply for, but if you're unable to, if people are unable to prove an exemption or prove that they're in compliance, then they would lose their coverage. So many other states have submitted this type of waiver as well. Arkansas was the only one who actually implemented it, and they saw incredible coverage losses off their Medicaid expansion program because ultimately what it creates is a very complex system of reporting how many hours are worked, proving compliance, as well as it's just a very bureaucratic, very burdensome system to have people constantly have to report. So this actually has gone to federal court questioning whether or not it's even legal to have this included in Medicaid expansion states. So they ultimately were ruled illegal in federal court, and it went to an appeals court, and just last Friday the appeals court also ruled them illegal. The only thing to note is that Many states still have these sitting over at the federal government, over at the Center for Medicaid and Medicare Services, also known as CMS, asking still to approve these waivers, and CMS is likely to continue approving them unless explicitly barred in federal courts from doing so. So other states that have had these approved but have chosen not to implement them are Virginia, Arizona, and Indiana. So they've seen the results in Arkansas, they've seen the court decisions, and they have chosen to not implement at this time because of pending litigation. So the other two waivers, I won't go into a lot of detail about them. The family planning one simply just would require those seeking any sort of family planning services outside of their primary care doctor to have to get a referral before they can see anybody else. It was approved recently in Texas. We expect it to be approved here in Idaho. However, there's again a question of legality, and so litigation will probably pause the implementation of that. But that one is uncertain at the moment. The Copay Backup is basically just like the work reporting requirement, but instead of people losing coverage, they'd be subjected to a small copay when they go to the doctor. So kind of what happens next with all of these waivers, I mean, it was a really big bill that had a lot of requirements and a lot of changes, and the application processes the state had to go through for the federal government were very long and took a lot of time and effort. They all required public comment periods at the state and federal level. And there were, on the work reporting requirement, there were thousands generated in opposition to the work requirement waiver. There were lots of comments submitted on the Imd waiver, and so it was a very lengthy process, and people were very involved, which is always really good. Kind of what we can see next is the Center for Medicaid and Medicare Service is going to continue reviewing these applications, and we expect to hear a decision on the work reporting requirement possibly in March or April. If it is approved, ultimately the Department of Health and Welfare is going to need about 6 months to update all the eligibility systems to be able to implement this in Idaho. And again, it may still be stopped and barred from actually being implemented in Idaho if litigation is filed. So I'm going to stop right there and see if anybody has any questions that you've thought of so far.
I'm not seeing any in the chat box yet. I will pop in and let you know when I do.
Okay, thanks, Anna. Okay, so now let's talk a little bit about where we are now. I mean, Medicaid expansion passed in November of 2018. That is a year and a half ago. Time sure has gone quickly. I know for a lot of people, it felt like it took a really long time to start being able to access health coverage through Medicaid expansion. But here we are. It's February of 2020, on November 1st. Idahoans were able to actually start enrolling in the Medicaid expansion program if they were eligible, with coverage beginning on January 1st of this year. So Medicaid expansion's been available for Idahoans that qualify for about a month and a half now, which is really exciting. And it's basically where we're at now. We have about 63,000 people who have enrolled in Medicaid expansion so far. The original projected number for budgeting purposes, they projected about 91,000 to enroll in the first year. And so we're actually on a really good path forward, a really good track of having a lot of people who qualify actually sign up for the program. One thing to note that a lot of people, if they don't need health coverage or they've been going uninsured and they've been healthy enough, we may not see people actually show up and apply for Medicaid expansion until there's a medical need or if they show up in the emergency room. There is a 90-day retroactive eligibility period that if you have a medical event, you end up in the hospital, or you've been accruing a couple medical bills and then you find out, oh, I'm eligible for Medicaid expansion. If you can prove that you were eligible the 3 months prior, they can actually go back and retroactively make you eligible for Medicaid and pay those medical bills. So kind of where we're at now, we've had, as I mentioned earlier, the last legislative session actually funded Medicaid expansion for the first 6 months. And now this legislative session in 2020, they're looking to fund Medicaid expansion for the first full year. And the great news is that the governor has been fully in support of making sure Medicaid expansion is funded, and he's identified a way to do so that is at a net zero cost to our general fund, which is where Idaho's tax dollars go to pay for education and other critical programs. So he identified about $19.9 million in general fund savings, and that's through behavioral health, correction systems, the courts, catastrophic care funds, and then also there's a fund from a tobacco settlement called the Millennium Fund, where he identified that to pay the other $12.5 million, and then also about $8.5 million from county savings from those indigent and catastrophic care programs. So as I kind of mentioned earlier, after it's been implemented for the first full year and we start getting that tax revenue in, we're going to see a net savings in the state starting in 2022 when they come back again next year and start setting the budget going forward. Some other really important things to know, Idaho's hospitals, doctors, clinics, they've been planning for this for over a year. Once Medicaid expansion passed, they knew that they had to get ready for the influx of patients who would all of a sudden would need to come in on a regular basis, get their preventative care. And so they started planning, and now they're ready. They are ready to start seeing patients. Many are accepting new patients. Which is really exciting that they knew this was coming, and so they've been planning for it. Over 60,000 Idahoans are currently covered, which is also really exciting. So we have tens of thousands of Idahoans that are receiving care without any tax increases, without any new costs to the public. And then also just kind of reiterating, it's a huge economic win for Idaho because we're not only saving state dollars, we're saving people's lives. And with all of our analysis that shows we're going to see a lot of new tax revenue over the next 10 years and jobs being created. So overall, this is it's great for people, and it's really great for our state dollars. All right, and any questions come through?
I'm not seeing any right now.
Okay. So let's kind of jump ahead and talk about how you actually enroll in Medicaid expansion. So I've linked here. You can click on this link and it'll take you to the website where you can apply online, or you can call this number. If you click on the link, it'll take you to the Medicaid expansion homepage where you can click and you can actually click on this picture here, and it'll take you as well, where you can go and click and apply, and it'll tell you exactly what you need to do to apply over the phone, apply online, or submit all that, or how to find a local office to go in person. So a little bit about eligibility criteria. So to be eligible for Medicaid expansion, you have to be a citizen and resident of Idaho. You have to be between 19 and 64 years old. So you can't be on Medicare, and you can't be under youth Medicaid or children's health insurance programs. You can't already be enrolled in another program, health insurance program, like if you have a disability and you're on it's Medicaid and Medicare kind of dual eligible services. You can't be on another form of Medicare. However, it does say here if you may qualify for regular Medicaid, so that's the old formula and eligibility criteria for Medicaid prior to Medicaid expansion. Or you might be able to get a tax credit through the health exchange. And if you're unsure if you qualify for Medicaid expansion, if you think you might make a little too much, you can still go and apply, and they'll actually be able to tell you if you qualify for a tax credit or if you would qualify for Medicaid expansion. But to give you an idea of the household income limits, I've put their criteria up here. Let's say you and your partner have a child, so you have a household size of 3. Your income limit on a monthly basis could not exceed $2,454. So that's on a monthly basis. Now, I know a lot of people have inconsistent income. They are unsure of, how much they might make. They think maybe they make under it one month, maybe they make too much the next month. Or let's say you're a caregiver, you have a certified family home, or you're unsure of how your tax-free income might be calculated with the department. It never hurts to go in and talk to a professional over there, a self-reliance specialist who can really help walk through all of those nuances that come with it. But ultimately, if this will at least give you a good guideline on what they're looking for. And basically, when you submit an application, you only have to submit the last 30 days pay if you have pay stubs. If you're self-employed, it might be a little bit longer, or if you are like an independent contractor or something, they may look at a little bit longer. But if you just have a job where you get pay stubs every paycheck, pretty much they just require the last 30 days pay. So let's talk a little bit about what Medicaid covers, because I think there's a lot of misinformation out there that Medicaid is not a very comprehensive health benefit, and it actually provides a lot of really great comprehensive health benefits. It includes all the 10 essential health benefits and provides two different plan options. There is the basic plan, and then there is the enhanced plan. Now, most people who are on Medicaid expansion are going to be under the basic plan. This is for people who don't have very high health needs, who don't have disabilities. Pretty much the average person is going to qualify under Medicaid expansion under the basic plan. So this is going to provide health screenings, your annual visits, going to the doctor if you're sick, this basically your physicals, prescriptions, hospital visits, doctor visits, and kind of those typical things that you would normally need to take care of. The enhanced plan is for individuals with disabilities, and so you usually have to get referral from a doctor saying that you are at a higher level of care that is necessary, and it's a little bit longer application process. But it's also very individualized, and they take into consideration a lot of different things. And so if you have high health needs, or if you're struggling with a disability but have been unable to qualify for Social Security or any of those other things and have had a hard time accessing health coverage, or the basic plan is not going to meet your needs, it doesn't hurt to ask if you can apply for the enhanced plan. And they'll be able to walk you through how you go about doing that. So here's another list of health benefits, just as a more comprehensive list, but basically you can get lab tests, you can have vision covered, dental, x-rays, weight loss, case management, prescriptions, as well as immunizations and hospice care. There's a lot that's covered even just under the basic plan. So this is pretty comprehensive under the basic plan, and then the enhanced plan covers a lot more options. And the great thing about Medicaid expansion too, in the comprehensive plan benefits that it has, there's a lot of behavioral health benefits. And so if you have a behavioral health condition, you have depression, anxiety, substance use, or other mental health conditions, you can access services. And this is kind of just a basic list of services that you can access. You can get community-based treatment, rehabilitation services, psychotherapy, Medicaid management, outpatient substance use disorder treatment, alcohol and drug screening, and case management. So it provides some really great behavioral health benefits. And if you want to see what, if you need help finding a provider or seeing what benefits are covered, you actually just go to Optum Idaho's provider network, and you can call Optum Idaho or visit the Optum Idaho website. So it's just optumidaho.com. But one big thing I really want to point out is that for crisis services, if you're on Medicaid and you're in the middle of a crisis, you absolutely should call 911 or go to the nearest hospital emergency room. It's really important to know you don't need prior authorization from Medicaid for help during a crisis. If you're in a crisis and you need to go to the hospital or anything like that, you don't have to get prior authorization. If you're unsure of what resources are out there, if you're in a crisis, you can actually contact 211, let them know what's going on, and they will help connect you to community resources to help you depending on your current situation. Another really important thing to know is that behavioral health services don't require a referral from a primary care provider. So if you want to seek counseling, you want substance use treatment, you want to go and get some case management or psychotherapy or anything like that under the behavioral health plan benefits, you don't have to go to your doctor and ask for a referral. You can simply just go to that optumidaho.com, look through the provider network and see who is available out there for you to see, and you can just call and they'll help connect you to a provider that accepts Medicaid. And that is also the same for substance use disorder services. They don't require a referral from a primary care provider. And I've linked here on how to help you find a provider that accepts Medicaid. So if you're on Medicaid and you're not really sure who in my area actually accepts Medicaid, your primary care providers, dental provider, behavioral health provider, all those are linked to the different websites available to be able to help find a provider under Medicaid. One other thing that is really good to know is if you don't have a car, you don't have access to transportation to get to medical appointments, there is a non-emergency medical provider that can help with those. That also is linked to help schedule an appointment to be able to take you to your appointments. And then also too, it's really important to know when you first enroll in Medicaid Expansion, you can choose your primary care provider, but if you don't pick one, if you don't pick a primary care provider within 60 days, they'll assign you one, and that will be your medical provider. But at any time, if you want to change it to somebody else, you just have to contact Department of Health and Welfare and ask if you can switch it to another provider. And Anna, I don't remember if I asked prior, but if these links can be shared with people in the chat box as well.
Yes, I'm working on that right now.
Perfect, thank you. And then also too, these links are found on the Medicaid Expansion website. So if you don't keep them today, if you just go to the medicaidexpansion.idaho.gov and click under Find a Provider, it will help link you to where you need to go. So that all of this stuff I'm sharing with you today, you can find on the Medicaid Expansion website. You can find your provider's transportation to appointments and also the full benefits booklet. I mean, it's like a 50-page booklet, but it goes over everything that's covered under Medicaid and process, and also provides details about if you have kind of a complex medical situation where you are not sure if Medicaid will cover or you need prior authorization, it walks you through how to do that and what might need prior authorization. And so that is a really good resource if you need it. So I'm gonna stop there. That's pretty much all the content that I was gonna go over today, but I'd love to see if anybody had questions that I didn't answer today or anything else that you'd like to know. So I'll pause for a second to let people fill out any questions they might have.
And I can go ahead and email that Idaho Medicaid Health Plan booklet, the full benefits booklet, out to anyone who's interested if you want to reach out to me. So it looks like I can link it in the chat box.
That's great. Thank you for doing that, Anna.
Okay, we have one question from Loretta. Do you have the medical guidelines for individuals to qualify for the tax credit?
Medical guidelines, are you, I'm assuming you're talking about, are you meaning the income guidelines, or, because for the tax credits, there aren't any health guidelines for anything for the tax credits. So basically they're income guidelines. And for, let me see here, for tax credits, it's for those who make between 138% of the federal poverty line up to 400% federal poverty line, and it's scaled according to what your income is for the upcoming year. And it's, let's see here, I'm just looking for, I don't have it in front of me, but if you, for a family of 4, and it's around above 35,000 a year up to, I want to say around 80,000 a year, but that's not complete, that's not exact. But I'm happy to follow up with the income guidelines for the tax credits. That also actually can be found on the Department of Health and Welfare's website for tax credits. And I'm not sure if that quite answered your questions, but I know there's not any health conditions in particular that you have to be able to qualify for a tax credit. It's all income eligibility based. So if I didn't answer your question, please feel free to keep asking so I make sure I'm answering it correctly.
Okay, great, Hillarie. I have one more question from Carol that said, the full benefits booklet may answer this question, but I'm wondering if there are limits on the dental coverage.
There are some limits on the dental coverage. I don't have the booklet in front of me to see exactly what all they cover, but I know it is a limited benefit to, I want to say, pretty just basic preventative care and getting your teeth cleaned and filling cavities. I think if you have a lot of extensive dental work, you may have to get authorization through your provider and submit to Medicaid to see if they'll cover it. But it does explain a lot more in the benefit booklet on what they'll cover under dental, but I do believe it is somewhat of a limited benefit.
Okay, it looks like we have a question from Janet that says, I work closely with college students who are unemployed. How would they qualify?
So right now, there is no requirement that says that anybody has to be working to qualify for Medicaid. It's all income based. So if you work closely with college students who are unemployed, they're going to school, they obviously don't have any income because they're spending all their time in school, they would just have to show to the department and submit their schedule saying that they're going to school, submit any documentation of what any financial aid they're receiving, and then there may be an additional form or two that they have to fill out if they don't have any income, but they can still just go directly to the department, go to the Medicaid Expansion website and apply online or over the phone or even in person. So they would just have to submit some of those documents showing that they're going to school, but then also may just have an additional form or two they have to fill out. But they would still qualify because there's no eligibility criteria saying they have to be working or have a source of income to get Medicaid. They just have to show that they are not making money, and they would qualify.
And I'm sending the Hillarie's Idaho Voices for Children. I'm sending that website in the chat box so people can click and learn more. I'm also sending the Close the Gap Idaho website so people can learn more as well.
Yeah, and also, so just to kind of let everybody else know, feel free to keep adding in some questions as they go, but Close the Gap Idaho and Idaho Voices for Children, we would not be able to do the work that we do if people were engaged and involved and really showed that they cared. And so we'd like to invite you to be a part of our Close the Gap Idaho network, learn how to be an advocate on really important healthcare policy issues. We're always looking to build our network as we work on Medicaid expansion issues, healthcare access issues, and so being a part of our network is a really great way to be tied into the work that we do to keep really up to date, as well as opportunities to be involved. And so we'd like to, invite you to join our network. We also, on a pretty regular basis during legislative session, we have a really great email action tool where people can send emails to their legislators asking them to support certain policies around Medicaid and Medicaid expansion, and we use that quite often. So we create a really easy email action tool that has talking points and pointers on how to craft your message, and then our tool sends it off for you, so you don't have to track down their emails or anything like that. So it's just a really great, easy way to be an advocate and be involved. And then also too, I'm constantly looking to talk to people about their experiences. And so if you're enrolled in Medicaid expansion, you have a mental health condition or a disability, I'm looking to talk to you. And I would love to talk to anybody else that you know who may have those experiences, because ultimately, as we saw throughout the ballot initiative and through different legislative sessions and getting Medicaid expansion passed and funded, it was really those personal stories that really had a huge impact, because it really paints a picture of the lived experiences of people who actually utilize these programs and how important access to healthcare really is for people in Idaho. And so if you're willing to share your story with me, I would greatly appreciate it. You can reach out to me. That's my email. Or we also have a really easy online survey. So if you want to just fill out a couple questions, you can click that link and it'll take you to our online survey. And then again, at any time, if you ever have questions about Idaho Voices for Children or Close the Gap Idaho, or how to be involved, or you're confused about something, or you're struggling with something, we work on all sorts of healthcare policy issues in regards to access to care and access to coverage. And so we've worked on a lot of different issues over the years around people losing coverage unexpectedly and things like that. So anytime you have questions or want to see if there's certain things that we're working on, please reach out to me at any time. That's my email and my phone number. I really appreciate everyone taking the time today to learn more about Medicaid expansion. And I'm happy to hang out for a little bit and answer any more questions. And so, yeah, just thank you all so much.
Thank you so much, Hillarie. That was excellent. I will stay on until probably about 3 so people can access these links. I've also linked the to that survey Hillarie mentioned where you can share your story. That's the last link in the chat box. Yeah, feel free to ask any questions up until Hillarie has to log off.
Yes, I'll hang out till 3. So if anybody has questions, just please feel free to ask.